If you're diabetic and find yourself waking up with high blood sugar, burning feet, or constant fatigue, even after a full night's rest, your body might be missing something simple: the right drink before bed. While medications and diets focus on the daytime, the real healing for blood sugar, nerves, and insulin resistance often begins at night. What you sip before sleep can either trigger more inflammation or gently guide your body into repair mode. In this video, we'll uncover 6 science-backed nighttime drinks that help stabilize glucose, soothe nerves, protect heart, improve kidney function, and even boost your body's natural insulin response, all while helping you sleep deeper and wake up feeling lighter. And the best part? These drinks are easy to make, taste great, and cost less than your average multivitamin. So let's dive into the nighttime healing rituals your diabetic body has been craving. First on list, cinnamon tea. For diabetics, nighttime isn't just for sleep. It's when hidden blood sugar spikes, poor insulin sensitivity, and cortisol-driven inflammation quietly sabotage healing. That's where a warm, aromatic cup of cinnamon tea makes all the difference. Cinnamon, especially the gentler Ceylon variety, is rich in a compound called cinnamaldehyde. This natural compound mimics insulin, helping your cells absorb glucose more efficiently. But what's remarkable is that cinnamon doesn't just work when you're awake. When consumed before bed, it can help calm the metabolic turbulence that often happens overnight in people with diabetes. In one research study, daily cinnamon intake led to a reduction in A1C by up to 0.8%, showing real impact on long-term blood sugar control. That's not a minor shift. That's a measurable healing effect. Cinnamon tea has no calories, carbs, or sugar, giving it a glycemic load and index close to 0. But its benefits go deeper. Cinnamon helps reduce nighttime cortisol, the stress hormone that diabetics often struggle to bring down. High cortisol levels in the evening are linked with disrupted sleep, higher fasting glucose in the morning, and increased insulin resistance. By lowering this stress response naturally, cinnamon tea helps your body transition into deep, restorative sleep while keeping blood sugar steady. It also slows down the rate at which your stomach empties, reducing late-night glucose surges from your dinner. Beyond blood sugar and stress, cinnamon tea helps protect against the complications diabetes tends to target. Its polyphenols calm inflamed blood vessels, enhance kidney filtration, and shield nerves from oxidative stress, especially those nerves responsible for regulating sleep, bladder function, and digestion. That's why many diabetics report waking up less often to urinate or experiencing reduced numbness in their legs after a few weeks of regular cinnamon tea. Did you know? Your body burns more fat and clears more sugar during deep sleep than while walking for 30 minutes. If your sleep is uninterrupted and hormonally balanced. To make it, simply simmer 1 cinnamon stick or 1/2 teaspoon of Ceylon cinnamon powder in 1 cup, 8 ounces of water for 10 minutes. For an extra anti-inflammatory boost, add 2 slices of fresh ginger or a pinch of turmeric during simmering. This trio works synergistically to reduce inflammation, support your immune system, and ease diabetic discomfort from the inside out. Optionally, you can sweeten it with a few drops of stevia for a pleasant taste without spiking blood sugar. Here's a helpful tip. Always choose Ceylon cinnamon over cassia. Cassia contains more coumarin, which in excess may burden the liver if consumed daily. Ceylon is milder, safer for long-term use, and widely available at most U.S. grocery stores or online for around $5 to $7 per 2-ounce jar. One important thing to keep in mind: if you're already using insulin or glucose-lowering medications, cinnamon tea may enhance their effects. Be sure to monitor your readings and speak to your healthcare provider about any changes in dosage once you start using cinnamon consistently. Second on list, chamomile tea. Chamomile tea may look like just a gentle floral brew, but for diabetics, it acts like a nighttime healing tonic. What makes it so powerful is its ability to target 2 of the biggest nighttime challenges faced by people with type 2 diabetes: high cortisol and poor sleep quality. Cortisol, the body's stress hormone, naturally drops at night, but in diabetics, this drop is often delayed or blunted, keeping the nervous system alert and blood sugar elevated. Chamomile helps regulate this by increasing glycine, a natural amino acid that calms the brain and nervous system. This not only improves sleep latency, how fast you fall asleep, but also reduces nighttime awakenings and blood sugar variability. In one study, chamomile tea taken daily for 8 weeks led to significant improvements in blood sugar control, including reduced fasting glucose and lower A1C levels by up to 0.7%. Chamomile tea is also glycemic free. It contains zero carbohydrates, zero sugar, and zero calories. But the impact it has on diabetic complications is anything but zero. For the nervous system, chamomile contains apigenin, a plant flavonoid that supports nerve relaxation, improves glucose metabolism in the brain, and may slow the progression of diabetic neuropathy. For kidney health, its mild diuretic effect helps flush toxins gently without overburdening the system, ideal for diabetics who retain fluid or suffer from nighttime urination. And for cardiovascular support, chamomile's anti-inflammatory properties help reduce nighttime blood pressure surges and calm the resting heart rate, two crucial metrics often elevated in diabetics with poor glycemic control. This cardiovascular calming effect protects the diabetic heart during the hours when it's most vulnerable, especially in those with a history of hypertension or microvascular issues. Chamomile also offers digestive benefits. Diabetics often experience bloating, acid reflux, or delayed gastric emptying, all of which can worsen during the night and disrupt sleep. Chamomile calms the gut-brain axis, reduces intestinal cramping, and even supports liver detoxification, making it especially helpful after a late dinner or high-fat meal. If you've ever tossed and turned from indigestion or a racing mind, chamomile tea might be your missing sleep remedy. To prepare chamomile tea, steep 1 tablespoon of dried chamomile flowers or 1 tea bag in 1 cup, 8 ounces, of hot water for 5 to 7 minutes. Drink it warm about 30 minutes before bed. You can add a small slice of fresh ginger or a few fennel seeds during steeping to enhance digestive benefits without affecting blood sugar. For a subtle touch of sweetness, stevia or a dash of cinnamon pairs beautifully with the floral notes. Here's a helpful tip. Look for organic chamomile tea that's clearly labeled caffeine-free, especially if you're sensitive to stimulants. A box of 20 organic chamomile tea bags typically costs around $4 to $6 at most U.S. supermarkets or online, making it an affordable nightly wellness habit. And one gentle reminder, although chamomile is widely considered safe, it may interact with blood thinners due to its mild anticoagulant effect. If you're on medications like warfarin, consult your doctor before drinking it regularly. Also, avoid chamomile if you have ragweed allergies, as the two plants share botanical families and may trigger a mild reaction in some individuals. Third on list, golden milk, with turmeric and almond milk. Golden milk isn't just a cozy bedtime ritual. It's a powerful healing drink that can help diabetics calm inflammation, improve insulin function, and support deeper sleep. Made from turmeric, plant-based milk, like almond or unsweetened oat milk, and often a touch of cinnamon or ginger, golden milk delivers a unique combination of antioxidant, anti-inflammatory, and blood sugar balancing effects that work quietly through the night. At the heart of this drink is curcumin, the active compound in turmeric. Research has shown curcumin can significantly reduce fasting blood glucose, improve insulin sensitivity, and lower markers of chronic inflammation like CRP, factors that are often elevated in type 2 diabetes. In one study, diabetic patients who consume curcumin-rich supplements saw up to a 21% improvement in insulin sensitivity over several weeks, meaning their cells responded better to the body's natural insulin. Golden milk is especially useful for diabetics who struggle with nighttime inflammation, joint pain, nerve discomfort, or elevated glucose levels caused by chronic stress. Curcumin crosses the blood-brain barrier and helps regulate the brain's sleep-wake cycle by reducing nighttime cortisol and supporting the release of melatonin. This can lead to deeper, more restful sleep, which is key for overnight glucose stabilization. It also supports nerve health, easing the burning or tingling sensations some diabetics feel in their feet at night. For the heart and kidneys, golden milk helps protect delicate tissues from oxidative stress while supporting healthier blood flow. When made with unsweetened almond milk, it adds magnesium, calcium, and vitamin E, nutrients that promote nerve conductivity, muscle relaxation, and hormone balance. What makes this drink even more diabetic-friendly is its low glycemic load, as long as you skip the honey or maple syrup that's often included in traditional recipes. Unsweetened almond milk contains only about 1 gram of carbs per cup, and turmeric itself has virtually no carbohydrates. Cinnamon and ginger enhance both the flavor and the blood sugar lowering benefits without spiking glucose. You can also add a pinch of black pepper, which increases the absorption of curcumin by up to 2,000%, maximizing its healing potential. Here's how to make it. In a small saucepan, warm 1 cup, 8 ounces of unsweetened almond milk, then whisk in 1/2 teaspoon of turmeric powder, 1/4 teaspoon of cinnamon, and a pinch of black pepper. Simmer gently for 5 to 7 minutes, then strain if needed. Drink warm about 45 minutes before bed. Optionally, you can add a few drops of liquid stevia if you prefer a hint of sweetness. Pro tip: for those who find turmeric a bit intense, you can start with 1/4 teaspoon and gradually increase as your body adjusts. The warm spices help relax blood vessels and support the natural drop in body temperature that signals sleep onset. And here's one thing to consider. Turmeric is a natural blood thinner, and while beneficial for most, it should be used with caution if you're on anticoagulant medications or have gallbladder issues. Also, avoid store-bought turmeric lattes with added sugars. They often cancel out the health benefits and can lead to unwanted glucose spikes. Fourth on list, fenugreek seed water. Fenugreek seed water may not have the comforting aroma of tea or the creamy texture of golden milk, but for people living with diabetes, this simple drink can offer deep nighttime healing from the inside out. Fenugreek seeds are a natural powerhouse of soluble fiber, alkaloids, and amino acids, especially 4-hydroxysolacine, which directly enhances insulin secretion. What makes this drink especially powerful when consumed at night is its ability to slow carbohydrate absorption, reduce overnight glucose surges, and support liver glucose regulation while you sleep. Research shows that fenugreek seeds can reduce fasting blood glucose levels by up to 25%, particularly when taken consistently over a few weeks. But even a single cup of soaked seed water at night may help blunt morning glucose spikes, a phenomenon many diabetics struggle with due to the dawn effect, where the liver dumps extra sugar into the bloodstream during early morning hours. Fenugreek seed water has almost 0 calories and no glycemic load, making it a safe drink for type 2 diabetics, prediabetics, and those with insulin resistance. But its benefits extend beyond blood sugar. For digestive health, fenugreek's mucilaginous, gel-like fiber soothes the stomach lining, reduces acid reflux, and improves overnight digestion, a key benefit for diabetics who suffer from gastroparesis or post-meal bloating. For the nervous system, fenugreek's anti-inflammatory properties help calm irritated nerves, potentially reducing nighttime burning or tingling sensations in the feet or hands. It also supports kidney function by lowering urinary protein levels and easing the filtration burden, while its gentle diuretic properties may help flush out excess sodium. For hormonal balance, especially in diabetic women dealing with PCOS or disrupted menstrual cycles, fenugreek helps stabilize insulin, which is intricately tied to estrogen, testosterone, and progesterone balance. In men, it may even support natural testosterone levels, which can drop in diabetic conditions due to insulin resistance and metabolic stress. That means more than just better sleep. It may translate to improved energy, mood, and reproductive health over time. To prepare fenugreek seed water, soak 1 teaspoon of whole fenugreek seeds in 1 cup, 8 ounces, of water overnight. In the evening, simply strain and drink the water about 30 to 60 minutes before bed. The seeds can be chewed afterward for additional fiber or discarded depending on your preference. For a stronger effect, lightly crush the seeds before soaking to release more of the active compounds into the water. Here's a helpful tip. If you find the taste bitter or nutty, add a slice of cucumber or a dash of cinnamon to the soak. This improves flavor without adding sugar or carbs. Fenugreek's flavor can also become more tolerable over time as your palate adjusts. A word of caution: fenugreek can slightly lower blood pressure and may interact with medications that affect glucose or hormones. If you're taking insulin, sulfonylureas, or hormone therapies, Keep a close eye on your glucose levels and consult your healthcare provider if needed. Also, avoid high doses if you are pregnant, as fenugreek may stimulate uterine contractions in large amounts. 5. Tart cherry juice. Tart cherry juice may come as a surprise in a list of diabetic-friendly nighttime drinks, but when used correctly and in small, unsweetened amounts, it offers a unique blend of healing properties, especially for diabetics struggling with sleep disruptions, joint stiffness, or nighttime nerve pain. Tart cherries are one of the few natural sources of melatonin, the body's key sleep-regulating hormone. For diabetics who have reduced melatonin production, common due to elevated cortisol or poor insulin signaling, this drink can help reset the circadian rhythm and promote deeper, more restorative sleep. In one research study, people who consumed tart cherry juice experienced an increase in sleep duration by up to 84 minutes per night, along with improved sleep quality scores. For diabetics, this improved sleep can directly translate to better overnight blood sugar stability, since poor sleep is known to worsen insulin resistance. What makes tart cherry juice different from sugary commercial fruit juices is its glycemic profile. Unsweetened tart cherry juice has a glycemic index around 54, which is considered medium, but when limited to 1/2 cup, 4 ounces serving, the glycemic load stays under 10. That makes it manageable for most diabetics when paired with a low-carb dinner or calming bedtime routine. More importantly, tart cherries are loaded with anthocyanins, potent antioxidants that reduce oxidative stress, inflammation, and uric acid levels. These compounds support nerve health, reduce diabetic joint pain, and protect blood vessels from damage, particularly in the retina, kidneys, and extremities, areas often affected by diabetes-related microvascular complications. Tart cherry juice also helps lower C-reactive protein, CRP, a marker of inflammation that is often elevated in type 2 diabetics and linked to heart disease. For individuals experiencing nighttime stiffness, restless legs, or aching joints, the anti-inflammatory power of tart cherries can bring real relief while aiding tissue repair during sleep. Additionally, it contains small amounts of magnesium and potassium, electrolytes that support muscle relaxation, nerve conductivity, and healthy blood pressure regulation. To make it work for your routine, drink 1/2 cup, 4 ounces, of unsweetened tart cherry juice about 30 to 45 minutes before bed. You can dilute it with an equal amount of water if the taste is too intense, or add a splash of almond milk to soften the tartness without increasing the carb load. Here's a helpful tip. Make sure you choose 100% unsweetened Montmorency tart cherry juice, not cherry juice blends or concentrates with added sugars or high fructose corn syrup. These will spike your blood sugar and cancel out the benefits. An important note, because it contains natural sugars, even in small amounts, it's best to monitor your glucose the first few times you use tart cherry juice, especially if you're using insulin or oral diabetes medications. For most, the benefits to sleep, inflammation, and blood sugar balance outweigh the modest carb content when portioned properly and consumed at night. Sixth on list, lemon water with apple cider vinegar. For diabetics searching for a simple but powerful bedtime ritual, few drinks offer the metabolic support of warm lemon water with apple cider vinegar, especially when taken in a properly diluted form. This combination gently primes the liver and digestive system while you sleep, helping to regulate overnight blood sugar, curb cravings, and improve insulin sensitivity by morning. Apple cider vinegar, ACV, is rich in acetic acid, a natural compound shown in multiple studies to slow down carbohydrate digestion and improve post-meal glucose responses. In one study, adults with type 2 diabetes who consumed diluted apple cider vinegar at bedtime experienced a 4% to 6% reduction in fasting blood glucose by the next morning. A meaningful drop, especially for those who struggle with dawn phenomenon or poor morning glucose control. The glycemic load of this drink is virtually zero. Both fresh lemon juice and apple cider vinegar are naturally sugar-free, low-calorie, and do not contribute to carbohydrate intake, but their benefits go far beyond just blood sugar. Lemon adds vitamin C, potassium, and citric acid, which helps prevent kidney stone formation and supports urinary tract cleansing. For diabetics with kidney stress or early nephropathy, this gentle diuretic effect can help maintain filtration efficiency while avoiding dehydration. Meanwhile, ACV enhances liver detoxification and may assist in clearing excess glucose from the bloodstream by improving glycogen storage. This drink also aids in digestion and appetite regulation, particularly for diabetics who suffer from bloating, indigestion, or sluggish motility after dinner. The acetic acid stimulates stomach acid production, improving protein and mineral absorption. Many people find they wake up feeling lighter, with fewer nighttime sugar cravings or discomfort when this is taken consistently. It may even reduce nighttime leg cramps through its potassium-boosting effect when lemon is included. To prepare this drink safely and effectively, combine 1 tablespoon of raw, unfiltered apple cider vinegar and 1 tablespoon of fresh lemon juice in 1 cup, 8 ounces, of warm water. Sip slowly about 30 minutes before bed, ideally after dinner has settled. Do not drink it undiluted. It's too acidic and can damage tooth enamel or irritate the stomach lining. You can optionally add a few slices of cucumber or a pinch of cinnamon for flavor without raising blood sugar. Pro tip, use a straw to protect your teeth from acidity and rinse your mouth with plain water afterward, but don't brush immediately as enamel is temporarily softened by acid exposure. One gentle word of caution: if you have acid reflux, ulcers, or are taking potassium-sparing diuretics, speak to your healthcare provider before adding this to your routine. While generally safe, the acidity may aggravate existing digestive conditions if not diluted properly. Final thought, even while you sleep, your body can be healing if you give it the right support. These nighttime drinks are more than soothing. They're scientifically backed tools to help balance blood sugar, calm nerves, and restore deep rest. If this helped you, don't forget to like, subscribe, and share this with someone managing diabetes. And tell us, what's your favorite nighttime drink? We'd love to hear in the comments below.